Welcome to the Genesis Healthcare Podcast, where we go beyond the traditional office visit to explore what it truly means to live with optimal health. Each episode brings you candid conversations with our Genesis providers and featured guests from across the health and wellness space, covering everything from primary care and prevention to aesthetics and lifestyle optimization. Whether you're ready to take control of your health through a Genesis membership or explore treatment options to look and feel your best, we're here to guide you every step of the way. Ready to begin your journey to better? Visit thegenesisdifference.com to schedule your first appointment or aesthetic consult today.
Well, thanks again for coming
Absolutely.
to the Genesis podcast. So welcome to Genesis, Meg.
Thanks, Joe. Thanks for having me.
Really? We've been talking a lot over, well, when we first actually met and you were a student, we were talking about women's hormones.
Oh, yeah, absolutely.
So that was something that I said to you that, Meg, you could make a practice out of women's hormone therapy. And I really want you to study women's hormone therapy. And at that time, you had a mother with breast cancer.
Absolutely.
And soon to be, I was going to have a wife with breast cancer.
Yes, sir.
Not on hormones.
Right.
But can you maybe expound a little bit on the other than me saying, hey, I want you to do hormone therapy, why you really dove into women's hormone therapies
You know,
and why it's important to women?
it's actually your challenge to research the topic totally shifted how I thought about hormone replacement therapy. You know, obviously having walked that with my mother and then of course walking it again with Trish, it put a bad taste of what hormone replacement therapy was actually, you know. And so I can remember looking at you when you said, I'd like you to do this. And I said, well, if that's what you want your next provider to do, you shouldn't hire me. You know, I'm not going to be
Because of the Women's Health Initiative.
Because the Women's Health Initiative, and I watched my mom walk out what they said happened. You know, I watched my mom get breast cancer from Primpro, you know, and I saw what the hardship that can be and how scary it is. And so all that, you know, you just looked at me and said, how about I hire you anyway? And you research this and then we'll talk about it. And so as I really went and did my own studying, and I did a lot of hours, you know this.
Yes.
I mean, there was 30 hours of videos of CME and multiple books. And I got to go to conferences and as I researched it, I now feel morally obligated to look at women and say, we can do something. And not only can we should. And it's going to have a huge positive impact on your life. And what we were so scared of isn't even real. It was inaccurate information that was presented to the public. And, you know, fear is a powerful motivator. And it
By a
halted.
reporter.
Yeah, by a reporter.
Not a clinician.
It was not the people.
Yeah.
And so it just...
But the clinicians dug into it and said, hey.
Well,
and so that was the Women's Health Initiative.
It did, you know, and it's funny because people, you know, everybody quotes that Women's Health Initiative, which was released in 2003. And then they assumed the study stopped, but that's the other thing. It didn't. It continued for another 20 years. And in 2023, they released a statement that said, oops, we were wrong. And it's estrogen in particular is very protective to the body and is very instrumental in women's health as a whole. And so we've had this 20-year gap where people failed to treat people and, you know, and they did it thinking they were doing the right thing.
Sure.
You know, but in the meantime, where women are, their quality of life has been greatly compromised and their health risks have actually gone up, not down.
Right.
You know, and I look back, all the data preceding that study was actually in favor of hormone replacement therapy. So how we took it so easily is baffling. But, you know, fear is powerful. And
look at the pandemic.
Exactly.
Fear motivated a lot of great clinicians to do things that they should have done.
Right. Or wouldn't have normally done. Wouldn't have normally done. And so again, it was all in the name of helping, but it still ended up being hurtful to the people.
Mhm.
And so, I do think that I'm very grateful they came back out and said, "Ooh, we got it wrong." They could have sat in it. Nobody likes to be wrong. So I'm grateful that they did come back.
I've gotten used to it. So
Because you're wrong.
yeah, because I'm wrong.
So I am. Anyway, so that started our journey here. I think you had already kind of knew you were going to go there. Obviously, my opinion shifted on how I was going to practice. And now, I don't think everybody has to have hormones, but I think when it is there and you need it, it is a game changer. And it is so instrumental to our well-being and as to function and do all the important things that we're called to do, men and women, both.
Right.
Both. And so I do think we're fortunate that now we've got a shift in how medicine is thinking about it, and we're seeing more and more people come to the table. And we're going to see providers now opening that back up. I mean, some of them have, over the last 5 years, I'm seeing more and more practitioners begin to start implementing it back into their practices.
Sure.
Because they didn't think it made sense either, but it's scary to go against mainstream medicine.
Well, because of litigation.
Oh, yeah, absolutely. It's totally litigation.
And so,
it's not about
like,
the patient's well-being. It's about litigation.
It's fear medicine.
Yeah, absolutely.
Fear of being sued, fear of losing,
Right.
your job. And so instead of actually doing no harm,
Right.
which we actually were doing,
Right.
but I mean,
Especially now that we
Right.
know, knowing
Now
what
that
we
we
know.
know,
Yeah.
it's like we are now going to be doing harm and that's human nature.
Well,
If you know something, don't do that anymore.
Right. Well, and truth is, we walk through life, and I say this a lot to patients, is we make choices with the information that we're presented in the moment. Hindsight's very different, and when we make different choices with extra information, absolutely.
Sure.
But as we grow and learn things and really get that solidified, now that evidence is clearly there, we have the opportunity to shift things and shift the monologue with our patients, shift how we practice, and start seeing the importance of this, and there's going to be a lot of people that will. The good news is we're not learning today. We've been doing this now for 15, 17 years, where we have had clinical experiences working with men and women in hormone optimization and really knowing who they are. It's way more.
This
than
isn't
just
a flash in the pan for us.
Correct.
Right. This
Correct.
is something that we've actually studied for
a long time,
over a decade.
Right. I mean, it's funny to me. I listen to podcasts and CME hours and things all the time. Any opportunity I can get it, I'm trying to stay on gear. And it is comforting and validates what we're doing because the data says the same thing we've been preaching.
It is kind of nice.
It is. It's validating because truthfully, we're here to help people, and I want to make sure we're doing it the right way.
Sure.
And so as we get this data, it is just adds a level of confidence where we were already confident.
Right.
And
we've been doing men's hormone therapy for
long time.
long
Same amount of time. Yeah.
Even longer.
Yeah, longer.
As far as medicine in general,
Right,
because
right.
that's actually some of the things that I really wanted to kind of dive into early on in women's hormone replacement therapies, because I was thinking, man, these guys are doing so much better. And
They're easier.
well, sometimes because guys actually don't open up as much.
Well, that's true.
And,
Very,
and,
very
and,
true.
and guys, women will say, hey, what's wrong with me? Please help
Right.
me. Please help me. So the women will beg for help,
Right.
and men are like, I'm good.
Right. That is very true.
So
That's
guys are tougher to sometimes get to open up or
Right.
get to walk in the door because
Right.
they're good.
Right.
They
wife
wake
has to
up,
make 'em.
they make the donuts. Good. Time to make the donuts. Doesn't matter if I'm tired. I'm going to do it anyway.
Right.
So, but I really think that for men have been cared for in modern medicine so much better than women. Women, we have dropped the ball in women's health.
Totally.
And as a
Whole.
Yeah. Now we, that's like I said, it's one of the big reasons why I was like, hey, I want you to do this. I want you to dive into this. And you have been fantastic and actually a leader in the Tri-Cities in women's health. And so it's fantastic to have somebody of your caliber on board with us. And it really is. It's it's fun. It's fun to bounce questions off of you. It's fun to, send patients to you. Some of them are fantastic that they get to see you. So yeah, she's just, yeah, you got that's great.
I love the referrals.
So, but it is awesome to actually have mainstream medicine adapting their thought to the things that we've been doing.
Yeah.
And,
Well, and it's for the people's good.
and it is for the people's good.
It's for the people's good.
And now that we have, the podcasters that are out there and people like us as clinicians who are trying to do the work, hopefully we've got some women that come back and go, okay,
That's me.
I'm willing to make that step and
Yeah.
go see them.
Yeah.
And so that's actually what, we were talking earlier a little bit about, what our impact needs to be here. And that's what I really want to teach these young providers is you've got to kind of do everything, not just give them standard of care medicine. I
Right.
mean, we're becoming standard of care is going to be hormone replacement therapy.
It is. It will be baseline in probably the next 10 years, I bet you.
Well, I mean, if you look at the endocrine system in general and what is what I call the puppeteer or the crane operator up here in the anterior pituitary gland. I mean, if it gets positive and negative feedback loops all the time, and the sex hormones with your estrogens or your progesterones or your testosterone and all of those things, or LH and FSH and TSH and all the acronyms of the endocrine system, and you get that out of balance, then it's kind of like everything falls apart.
Oh yeah, they all play together. Your
Right.
thyroid, your metabolic hormones, and we've made it so that the metabolic hormones or the thyroid, even that's kind of been dismissed, but we have made them the front runners and put these to the side as if they don't impact what we're trying to correct anyways. And our hormones greatly affect how our bodies process our sex hormones, our metabolic hormones, our neurotransmitters. I mean, our organ systems. I mean, our brain is affected by estrogen. We know it. And the receptors there are a big deal.
Yeah. Estrogen receptors all over the body.
Correct.
And so you look at that and also our, talking about nutrition and what we've done and how we've wrecked the endocrine system by the Western diet
Right.
and spiked our insulin levels, and we're becoming insulin resistant. We're putting fat cells around the visceral, or we're putting visceral fat around. And so that's different estrogens and different estrogen resistances and insulin
It
resistances.
exacerbates the very problem we're trying to address.
Right.
And if you don't hit both, there is no root fixing.
Right. And so we've got the TikTok sensations of things like GLP-1s,
Correct.
The Ozempics and the Metformin or the Victozas and Zepbounds and all of those things, the GLP-1s, and they're working, but they're working at one part of the endocrine system.
Right. And it's not a permanent solution
Right.
until we hit it all.
You have to have a
You have to hit it
provider
all.
who talks about nutrition to adjunct GLP-1.
Right.
Hormone balances to adjunct GLP-1 and
Absolutely.
nutrition. And if you don't have something like that, you need to seek somebody like that.
Agreed.
Because
Agreed.
if all they're going to do is give you Zoloft and Premarin, you need
got
to
a
walk
problem.
away.
Right. We have a problem.
Right.
There's better ways.
Zoloft
It's
has
better.
its place, but
Right.
there are better. And most Zoloft deficiencies are
Aren't.
truly maybe a progesterone deficiency or an estrogen dominance,
Right.
and you need to look into that.
Right.
And
Right.
and so that's the beautiful thing about doing things like that. And so let me ask you a question about how you look into that. Like, how do you look into a patient that comes in and says, I think my hormones are whack?
So when I think about the average person that comes in, and we're at least getting to that place in life where women are recognizing and we're seeing it more, and there is that social media has at least helped women recognize that, oh, maybe this is hormones, and so they're coming in and their resilience is down. They're overwhelmed and overstressed by something they've historically been able to tolerate and do. They're taking care of multiple kids, and sleep is starting to get messed up. Sometimes we have the hot flashes and night sweats we liken to this, but sometimes it's not that obvious, and it's more of this, I can't lose weight and I'm exercising. I can't lose weight and I'm eating right. I can't sleep anymore. I am frustrated and overstimulating and vibrating on the inside all the time, and I can't think clearly, and words don't come up, and my joints hurt. My joints.
That's what people don't even understand.
No, my joints hurt. I mean, no lie, this year I can't say cured, but I really helped 2 women who had massive joint pain, and we had done everything. We had had surgery, we had had PT, we had had injections. I put estrogen on board, and in 3 days, Joe, totally fixed.
Pretty cool.
Well, and we know it's a thing, but actually that was super awesome.
It is kind of cool to be
I felt
awesome.
pretty magical that
It's
day.
okay.
And they both called in 3 days and were like, it's totally fixed it. And how fast was that?
Yeah.
I hate that it took me so long to see it, because I do what I do. But here we are. So, sometimes when we start getting this hormone imbalance, it's subtle and quiet, and sometimes it's loud. Sometimes it's very obvious as something's going wrong.
Right.
And so, I was looking at a chart the other day, and as our hormones start to shift, in the very beginning, I think it's more subtle, and it can happen after your first kid. It can happen after your third kid. It can be after some big stressful event. I think about, particularly in today's world, we're busy, we're fast-paced, we're overstimulated. I mean, who sits down and watches a movie alone? We're playing on our phone, we're ordering groceries, we're just this busy society, and I think it encourages this chronic stress level to come. And if we have this chronic stress all the time, then naturally our progesterone, it being the first one and the most sensitive to it, starts to get compromised. Mm-hmm. And as that progesterone starts to get compromised, it's the body's mechanism of protecting us. Cortisol has this awful rap, but it's kind of good for us. I mean, it's supposed to be there. Yeah. It's this subtle.
Will you check my cortisol?
Exactly. Which I have lots of feelings there.
Right.
But it is this chronic picture of the stressor that stays underlying all the time, and I definitely can say I can fall into that category. I don't know that I'm stressed. I can function. I can do everything. I don't know that I'm stressed.
Until you can't turn your head because you're in spasm.
Yeah.
Yeah.
It will eventually rear.
Yeah.
So, all that to say, we start to see that progesterone declines. And sometimes it's, it's pregnancies and children that trigger it. And sometimes it's this low level or high level of stress that it causes the fall to come. And then naturally, as women age, we have, you had mentioned it earlier, we have this feedback system with the HPO axis. And as our ovaries begin to produce less and less eggs, there's less feedback to the body, and there's less hormone surges that come to the body. And it's slow and gradual over time, so we miss it sometimes.
Sure.
And so when you think about progesterone, it has this slow decline over time. And then when we start getting closer to those perimenopausal years, estrogen is literally all over the board. So it's this crazy chaos storm. So it gets a little more obvious at that point but they're like, I'm great, I'm awful, I'm great, I'm awful, I'm in the middle, I can make it, I'm never going to make it, and they feel crazy, because if this is how your body is responding all the time, no wonder.
Yeah.
And people haven't been educated in this. Women don't know what are happening in their cycle. They don't know the follicles.
Your grandma's not said that.
No.
Mama's not said that.
No, nobody said it. And the men look at you and just say, you're crazy.
Well, yeah.
You're crazy.
I call you crazy all the time.
Yeah. You don't call me crazy.
Not you.
Not me.
Never.
I'm a unicorn.
Absolutely. Definite unicorn.
But it is, no wonder we think it's just Zoloft. Uh-huh. I mean, that's why we go there. And sometimes we need Zoloft. There's people that I look at them and I'm saying, you're a hormone problem and you have anxiety, or you have hormone issues and true blue depression. We can have both. That's the other thing. We can have both. But I think a lot of times, you get these women come in here and they're like, I've tried every SSRI and nothing works.
Yeah.
Nothing
Man,
works.
well, how are we trained? This one is going to work for a little while, and then you're going to need to
Change
switch,
it.
or you're going to add something like a
Add,
dopamine, or add
add.
a
Atypical.
norepinephrine. Yeah. So
Yeah.
you look at that and you go, oh, you just need more.
Right.
You just need more.
Right.
And so, or you just need to change this one.
Right.
When most of the time it is truly a estrogen dominance and a
Right.
progesterone deficiency.
Deficiency. Yeah.
Yeah.
Absolutely.
And you throw a little testosterone and DHEA in there and you're like, woo!
Woo!
All right. I like my husband
back.
again.
I'm back.
Yeah. And the guys are like, what'd Meg do?
Yeah. Go back and see her.
Yeah, that's right. Go back and see her. Right. So yeah, I used to get presents
Oh yeah.
from
definitely.
guys.
Oh yeah. Yeah.
So,
Definitely.
yeah. So anyway, it was,
Yeah.
but it's also, that's one of those things that as a clinician, like this should be in your bag because it's so rewarding
Mm,
to do what you do.
right. It honestly, it's
it's
what
not
keeps us here.
easy.
No, it's very hard actually.
But it's so rewarding
It is.
when you have the journey of watching someone, and this is pretty bold to say, almost on the edge of divorce
Mm-hmm.
or
Life.
yeah, suicidal.
Yeah.
I mean, you start talking about suicidal stuff, and you start looking at, okay, this is a real hormonal problem.
Right.
I mean, when it's getting you to the depths of
Complete despair.
complete despair.
All hope's gone.
So, like, to be able to watch that, just almost like pull them out of the jaws of death,
Mm-hmm.
literally, and go, wow, the sun did come up today. That was really
Right.
cool. It was really nice to see the
Mhm.
flowers today. It was, and something that I do like to see with hormone therapy, men and women, is to see them first time, and then they list the symptoms, and then they come back a month later or at their follow-up, and they're saying, well, I'm just not doing any better. And I'm like, well, let's go through these symptoms again.
Right.
And they're like, well, I am sleeping a little better. Well,
My energy's
I am getting up and doing. I was like, so you're not doing any better. It is really kind of funny
Yeah.
because there'll be 15 things that they had wrong, and 14 of them were improved.
Right.
Not great necessarily, but
Right.
improved. But that one thing, it's just,
Sometimes that there's a mental lag
yeah,
where people
is.
just don't see it yet, and that the functional component precedes the feeling,
yeah.
and
It
so,
is, but it is kind of fun, and I think that's the hard part
right,
of women's hormone therapy as much as anything, is that there are multiple things going on
right,
psychologically and physiologically that like the symptomologies,
Right.
right? The symptoms are vast.
oh,
Guys are like,
huge myriad,
I'm just tired,
yeah,
or my libido's gone.
libido,
Yeah, it's kind of I use the analogy all the time. Is like, women will come in to talk to me about anything and everything except the libido, and guys will come in to talk to me only about the libido. So it is funny that they will talk about nothing else. Hey, what about my sex drive? Why is that gone? So
Yeah.
I'm like, well, there's multiple reasons, and
Absolutely.
and truly, in the social media craze of GLP-1s, which is the Ozempic, and even some of the other GLP-1s, in that area, if you don't fix that insulin level, if you don't get after the nutrition, the hormone therapies will always lag.
always.
If
They're
you've got
so
to,
intertwined,
right.
and that's where people are. Golly, we're missing it so much there.
Yeah, and vice versa.
Yeah,
I want
they're both feeding each
Yeah,
other.
and I want to really address that because
Yeah.
so many people think that weight loss is so much more important than actually hormone balance.
Mm.
But if you are optimal in your health and optimally balanced hormonally, the side effect of being of optimal health is weight loss.
Right. Well,
And that's a big deal
right.
because so many people go after the primary goal of weight loss and their hormones stay wrecked. And so
They're still not
and
better.
their skin doesn't look good.
Correct.
They're saggy and they're dry and they're, and it's just
Ozempic face.
Ozempic face, right? And so it's one of those things where you go, whoa, that's not healthy looking.
Right.
Yeah, the scales prove that you're successful on a GLP-1.
Right.
However,
Do you feel better?
Do you feel better?
Do you feel better?
How's your hair look? How's your skin look? How's your energy? How's your sex drive? How's your
Confidence.
How's your confidence? Absolutely. How's your sleep?
Mm-hmm.
You know, so that's the thing that drives me kind of crazy about the scales and what people perceive as healthy.
Right.
It's
Right.
like
You can be skinny
all
fat
that
all
weight.
day anyways,
Yeah.
too. Speaking of GLPs,
yeah, right.
you know, and so they both feed each other. If hormones are optimized, we should begin to you have to hit the insulin or it'll undo what we're trying to do here in the first place. If these aren't if your hormones aren't correct, then your weight loss journey is so much harder. It requires balance and addressing both realms to actually get healthy, stabilized, persistent weight loss. That, you know, who wants to lose that 100 pounds more than one time, or 20 pounds or 10 pounds, whatever your goal may be? Who wants to do that over and over and over again? You know, you work really hard for it. We say no to things all the time so that we get this, you know, that pretty little number on the scale. And we still are left wanting and working hard because neither or not both sides were addressed, you
Right.
know. So
And that's super frustrating to have a patient, their primary goal be weight loss.
right.
But it's also pretty awesome to open up the door and go, okay, we'll make that as a primary goal. But you need to throw away your scales.
Yeah.
Right? We need to throw away your scales and let's get optimal health. And along with optimal health, you're going to get weight loss.
You know, I've started changing my language. Being a woman and living some of these things that I actually didn't think I'd experience because I knew all the stuff. Let life come teach you lessons, right? I know what to do. It won't happen to me.
You know, God
You know?
does that.
Oh,
to us
yeah.
sometimes.
He
It's
definitely
like,
lets me walk it. He lets me walk
you
it.
know better than I.
Yeah.
Let me help you with
It's humbling, but it also, you know, nothing's more motivating than it happening to yourself. You know, we get really motivated when it's the people closest to us. We dig deeper, we research more, we go looking for alternative routes. And so I definitely have walked that in recent years, and it's helped me, you know, shift my monologue, shift what I mean and what I say. And one of the biggest things that I've started clinging to now is I'm not chasing a weight, you know, and I've never been somebody that thinks the number is 100% important. A BMI doesn't give us a true picture of health in a lot of cases. You know, if you're healthier, a BMI is actually pretty inaccurate when we're full of muscle. When we're sedentary, a BMI has its place.
Right.
With that being said, I've started changing my verbiage with women as we are changing body composition. I don't care what you weigh. I mean, there's a point where we need it to be healthy, but I don't exactly care what the number is. If your lean mass is healthy and your fat mass is low, you know, if we need some, I mean, women are made to be soft. The Lord made us by design to be soft. So, but I want a soft, hard muscle, you know, and if that's what I
Yes.
want, so do they.
Yeah.
You know, like we want a good, healthy balance there, where there are some curves to women and there are some love in our body, and you know, a little bit of cellulite's normal. It's not weird. You can be very healthy and still have a little bit of cellulite on your body, but we want it in healthy ratios, and we want strong bodies and capable bodies and bodies that can do this life well.
Yeah, and the longevity studies
Correct.
are in strength,
They are. I mean,
functional.
can you carry your
fitness.
weight? Can you pick up a person? Can you get your kid out of the house? Can you know, it's these things that we're chasing. And if we change what the goals are, we have the ability to really get healthy, happy people.
Yeah.
You know, and that is, so the dialogue has to change, and what we're chasing has to change. And I do think there's absolutely a place where we need the hormone optimization. Sometimes we need a GLP-1, not always, but we need a GLP-1. But the nutritional counseling has to be there. The weight resistance has to be there. I think if you're on a GLP-1 and you aren't lifting weights, we are doing a disservice for giving you the script.
Yes.
I mean, and I adamantly feel that way. I mean,
Yes.
they come in and I'm like, if you can't lift, if you can't figure out how to get it in your world, I don't want to give you the drug. I think weight
Or if you
loss-
can't give me a food journal.
Oh, that too. I mean,
If you're that
we're going to hurt
lazy.
your body, because what's happening is GLP-1s have this great ability to help us lose weight. And it's very good at it.
Yes.
And the higher the doses, the faster it can come. However, I'm not a fan of that.
No.
I think this rapid weight loss is making for poor skin. It is decreasing the collagen in our body. We are losing muscle while
Way too much.
we're losing so much muscle. Well, you want to know what happens when we lose our muscle, Joe?
Feedback loops to the hormones.
Hormones get out of whack, or we gain the weight back. You gain the weight back even on the drug. I've had the conversation multiple times where I look at people and I'm like, you're on the highest dose of the world's best weight loss drug and you're gaining weight. That's not failure of the drug. It's a failure of you implementing the things that were going to make it successful. It's a tool. It's not the plan.
Right.
It's not the plan.
The
It's
easy
a
button's
tool.
not there.
No, you still have to work. The other conversation I have with people that I really think has to hit home is in life, we are bound by guidelines. Eat right, exercise, sleep well, manage our stress. We're bound by those guidelines. And I think those 4 foundational pieces have to be in place. And we have to be addressing those things. And if we aren't putting the exercise and the protein in and those things, we're gonna miss out and do harm in the long run. So you have to do this component to get and maintain what we are already chasing, and to keep it.
Yeah.
You know,
Well, you alluded to stages of life that you go into,
Mhm.
you've gone into,
Oh yeah.
and you didn't think you were going to have that.
Oh yeah.
And you didn't think you were going to have that.
No, I know
Well,
what to do.
What do you think is going to happen when you turn 40?
When I turned 40?
I know.
It definitely hit me in the face.
Right. So, or when you turn 50, or when you turn
Right.
60, or so if you're not preparing for 60 in your 30s and 40s,
Right.
you're behind the 8 ball.
Correct.
If you're not preparing your body for the next stage of life, and that's something that is really, it's humbling to me.
Mhm.
It's humbling to you as providers who know things, and that I know nutrition, I know
Right.
health, I know
Right.
how to lift weights. I don't
Right.
necessarily like to, but I know how to do those things.
Right.
But if I don't implement them, then I am going to struggle when I turn 50.
Right. That's even where I was going with that thought is if we don't have restrictions and boundaries in this section of our world, implementing basic foundational
Mhm.
things, then as we age, as we have birthdays, then we get bound by disease.
Right.
And so truth is everybody's like, well, I want to have my Coke. I want to eat the burger. I want to go out and have cocktails with my buddies. I want my glass of wine, but there has to be limits and boundaries in which we do these things, or we will be limited and bound by disease. And so you get to be bound by healthy choices, or we get bound by disease and our body.
Yeah,
You know?
and I think our medical environment has allowed us to think that way,
Right.
is that we can have freedom in whatever we want to do,
Right.
and there's a pill that'll fix it eventually.
Right.
And that is the dichotomy of Western medicine and Western disease,
Right.
and what we try to teach people.
Speaking of that, I've got this patient of mine, and I use this person as an example all the time. They are the most compliant patient with their medicine. They are the most compliant patient with every drug everybody has ever put on goes down that hatch. I mean, if we ever needed to, you could lance his blood and we could have a pharmacy because he's so good with his medicines. But there is still disease in his body. And so there's diabetic neuropathy. There are 15 cardiac stents despite perfect compliance with the medical regimen put before him. And here we are still having the disease state because he likes the Coke and he wants the cheesecake.
Right.
The cheesecake and the Coke at the same time. These things. And so because we weren't consistent, and there are phases where things were great and grand and people feel good and optimize their well-being and feel good. But because it required work that we stay faithful with, we fall off and we go back to old habits.
Mhm.
And the same is true even when women are using these GLP-1s, and men both. I don't mean to isolate that. If they don't do the work while they're on the drug to change what got the drugs need in the first place,
Mhm.
then they'll go back too. We still get disease states that are not fully treated.
Yeah, and that's what I really want our patients and our community to understand. If all you're doing is seeking a provider to get you an easy button, it's not there.
No.
You need to be seeking providers that actually dive into everything about the disease state or the condition or the goal that you want out of life.
It's multifaceted.
It is. And so if you don't go after insulin resistance, if you don't go after nutrition, if you don't go after hydration, if you don't go after hormonal balance, then we are missing the boat. And we've done that. And even medicine, I talked about a general practitioner 50 years ago or 60 years ago, did surgery, did deliveries, did all sorts of different, they did it all. Now we have subspecialties, maybe 5 or 6 subspecialties in orthopedics.
Right. Oh, yeah.
There are a couple hundred specialties now to where we have separated and fleshed out medicine to where, they do that part of medicine and they do that part of medicine. When in reality, it's like nutrition should be our medicine.
Mm-hmm. Let food be thy medicine.
Oh, that's really weird. and we should take the approach of it's our health. It's not the provider's health that they're trying to give to me. It's my health. I need to take care of it.
The responsibility in it.
Pridefully, I really like when I am sitting down and getting ready to stand up, say like at church or something, and it said, rise and sing this song. I don't put my hand down. I stand up. I don't want to have a limiting factor of a 3-point stance, right?
Right.
My 2 feet and my one hand pushing me up off of a chair. I don't want that.
Right.
I pridefully, every time I stand, I just stand.
Right.
Because I want to have that core strength all of my life. And when I see any type of life event happen to me, I have the strength, I have the range of motion to be able to adapt to that, whether it's a stage of life in aging or it's a stage of life of disease or infection or whatever that may have been, that I still have the body to overcome it because I have functionally prepared my body for that.
Right.
Even like functionally preparing my body for a vacation and having freedom, because there's multiple people out there, multiple friends of mine, and like, you eat very well and then you don't. And I'm like, yeah, you see me at an event and I might not eat well.
Right.
I might not
have a break.
Yeah.
I mean, we're living.
But I'm trying to prepare my body all day long for that event.
Right.
Or all month long for the vacation, or, to have the freedom of having, I haven't had a Coke since I was 28.
Long time.
So there are certain things that pridefully, I'm sure that I will not do. And I haven't had a soda because I know how awful it was for my body. And at 28 years old, I couldn't stand up.
Right.
Trish had to get me up out of bed. I tell that story all the time. Is Trish had to pick me up out of bed when I was 28. And I was, I was a pretty good ball player in my early 20s. Mm-hmm. And at 28, I couldn't get out of bed without assistance.
Right.
I thought, oh my goodness, how am I going to make it the rest of the next 40 years to take care of my family? So that was a big part of my journey in going, okay, this is a lot of where I better pay attention and I better stay away from my Diet Coke.
Well, if these thoughts resonate with you and you think that you can identify with any of these struggles we've even talked about today, and you're looking for a more comprehensive, real approach to getting healthy, to being able to connect to the people that are going to come alongside and walk this out with you, then come see us. Come be a part of Genesis, and you can do that in a couple ways. You can call us. You can reach out at thegenesisdifference.com and
experience the difference.
Yeah.
The difference
Yeah.
that we want you to experience.
Right.
So
Come be heard.
I really appreciate you coming by. I really appreciate you being a part of Genesis, Meg. It is truly fantastic to have you part of my life and my career.
Well, I do appreciate the opportunity, and this is home, and I'm grateful to have had the chance to be here all these years.
Fantastic.
Thanks for tuning in to the Genesis Healthcare Podcast, empowering you to live optimally. Ready to take the next step? Visit thegenesisdifference.com today to learn more.